Welcome to the second module in the diabetes series. The learning outcomes of this part of the module are to describe the terms used to classify diabetes, to describe how to diagnose diabetes, impaired glucose tolerance and impaired fasting glycemia, and finally to describe the role of a glucose tolerance test in diagnosing diabetes. There are lots of terms currently used in diabetes, such as diabetes type 1, diabetes type 2, impaired glucose tolerance, impaired fasting glycemia, and gestational diabetes. The terms non-insulin dependent and insulin dependent are no longer used, since patients with type 2 diabetes can go on to insulin as part of their treatment, and in patients on insulin treatment can have all hypoglycemic agents. The terms type 1 and type 2 are defined in pathological terms, with type 1 mediated through an autoimmune mechanism and type 2 as a condition with a relative deficiency of insulin and insulin resistance. Impaired glucose tolerance and impaired fasting glycemia, often called prediabetes in other countries, are states of where the fasting sugar is not quite at the threshold to define diabetes, but is at putting patients at an increased risk of cardiovascular complications. The level for diagnosing diabetes is based on the fasting glucose level and has actually lowered over the years. The level of blood glucose set to diagnose diabetes is set at the point which shows a significantly increased risk from microvascular and cardiovascular complications from the increased sugar level. Whenever a patient first presents where you're considering diabetes, the first thing is to take a history looking for the symptoms of diabetes. These include polyuria, polydipsia, weight loss and recurrent infections, amongst others. If the patient is acutely unwell, a random capillary blood sugar should be taken, a urine dipstick looking for ketones in consideration of admission. If the patient is well, then a fasting glucose should be arranged. The fasting sugar can have one of three results. If the level is below 6 millimoles or less, then the patient is not diabetic. If the level is greater than 7, then it depends on whether the patient has symptoms or not. If the patient has symptoms, then again, they're diabetic. If the patient does not have symptoms, then a further fasting sugar should be arranged about 1 to 2 weeks later. And if this is over 7 again, and we have 2 readings above 7, then again the patient is diabetic. If it's below 7, then a glucose tolerance test should be arranged. The last result is if it's between 6.1 and 6.9 millimoles on the first fasting sugar test. In this case, again, it should be repeated. If the second test is below 6, then they're not diabetic. If the second test is above 6, then a glucose tolerance test needs to be arranged to try and elucidate further what the diagnosis is. You're now at a pit stop, and what I'd like you to think about is how do you carry out a glucose tolerance test, and what information do you tell the patient? A glucose tolerance test is carried out following a fast of 8 to 14 hours, and this should be preceded by 3 days of an unrestricted diet with at least 150 grams of carbohydrates and normal physical activity. A blood test is taken, and then the patient is given a glucose load of 75 grams, equating to 410 ml of Lucozade. It's chilled to reduce the chance of nausea in the patient. The patient should drink it over about 2 to 3 minutes. The first blood test is taken just as the patient starts drinking. During the test, the patient should rest and should not eat, smoke or drink anything other than a glass of water. The second test is taken exactly 2 hours after the first, and the results are shown at 0 minutes and at 2 hours. At 0 minutes, if the fasting test is greater than 7, then they're diabetic. If at 0 minutes the fasting sugar is less than 7, then you have a look at the 2-hour sugar to see what the result is. If at this point it's either greater than 11.1 or equals to 11.1, then again the patient is diabetic. If at this point the sugar level is between 7.8 and 11.1, then they've by definition got impaired glucose tolerance. If it's below 7.8, then the patient has impaired fasting glycemia. It can be seen by this that when you're interpreting a glucose tolerance test, you don't actually need both a 0-minute fasting glucose above 7 and a 2-hour reading above 11.1 to make the patient diabetic. If you look at all those patients diagnosed with diabetes via glucose tolerance test, only about a third, 28%, have both the 0-minute fasting glucose greater than 7 and a 2-hour reading greater than 11.1. In 31%, it's only the 2-hour reading that's diagnostic, at 11.1 and above, with a normal 0-minute. And in 40% of cases, it's the 0-minute that's greater than 7 millimoles, and a 2-hour reading is less than 11.1. This comes on to the accuracy of glucose tolerance test. It's not actually the gold standard that you think it is. If you repeat the glucose tolerance test on a patient with impaired glucose tolerance 6 weeks after the first, in about a third of cases, it'll still show that the patient's got impaired glucose tolerance. In about another half of patients, they'll have impaired fasting glycemia. But of more interest, in about 10%, the patient will actually shown to have diabetes at the second test 6 weeks later. This is showing that really the gold standard glucose tolerance test is a very poor when it's repeated, and its reproducibility is not great. Finally, a word of caution. It is very important not to carry out a glucose tolerance test on patients who are already known to be diabetic by virtue of a fasting sugar test. There have been patients admitted to hospital in diabetic ketoacidosis due to the requirements of the glucose tolerance test to fast and then given the sugar load as part of the test. To summarise, the following diagnostic levels are used to diagnose diabetes. A patient has diabetes if they have a plasma fasting glucose of greater than 17 millimoles with symptoms on one occasion, or without symptoms, the fasting sugar has to be above 7 on 2 occasions, at least a week or two apart. They can also be diabetic on a 2-hour plasma glucose level of greater than 11.1 millimoles. Impaired glucose tolerance is defined as a plasma fasting glucose of greater than 6 but less than 7 millimoles with a 2-hour plasma glucose level on a GTT of between 7.8 and 11.1. And finally, impaired fasting glucose is defined as a plasma fasting glucose level between 6 and 7 with a 2-hour reading on a glucose tolerance test of less than 7.8. I hope that you've enjoyed the module. There are further modules in this series which can be accessed.